Dermatology Clinic. We are on the 18 November Street opposite the Shady Hotel in Gobra, and principally I deal with skin and hair problems. Like I said earlier, skin based and also for hair fall, and also we have lasers which we use to promote skin health. The most frequent skin problems I would say is one is pigmentation, perhaps because of the kind of weather Oman has throughout the year, and the second common would perhaps be acne and marks, and also recently I have seen a surge in hair fall. I get many people complaining of hair fall. It's wide both in men and women, and also surprisingly even children, teenagers, they come with hair fall. So I would put these three as the most common. In winters, even a person who is having normal skin tends to start becoming more drier. Dry skin is where the problem arises. Like if a person has always had dry skin, then it tends to exacerbate in this kind of conditions. I think simple cleansing routines, not over cleansing, limited cleansing I would say, maybe 2 to 3 times in a day with gentle soap-free cleansers, and applying moisturizer. I think this is the most important step. Moisturizer should not be just one-off application, it should be regular, it should become a routine. At least 2 or 3 applications immediately after washing face or taking a shower definitely helps. And if the skin is still very dry and still is creating a problem, I think it's better to consult a dermatologist who will advise you perhaps regarding topical medications or simple peeling sessions which will help the skin to retain water. And the other thing I would suggest is to avoid extensive use of scrubs, because even scrubs generally tend to dry the skin. Causes for dark circles are plenty actually. I would still put genetics, environment, lack of sleep, which is now again very common across all people, and sometimes overuse of anti-pigment kind of creams, which again makes it worse. All this, it's a combination of factors. And treatment again is not easy. Whenever the cause is multifactorial, we call it, like many factors, the treatment cannot be a one simple cream or one simple tablet. Again, it's a combination treatment where we give advice on peeling sessions, we give advice on diet, and most of the patients do agree that they need to improve on their quality of sleep or even quantity of sleep. Sometimes only 3-4 hours of sleep chronically, it affects the skin around the eye. And to avoid using excessive anti-darkness or anti-pigment creams around the eye, because all of us know skin around the eye is quite sensitive and reacts very fast to creams. And also the general healthy advices like eat well, drink at least 8 to 10 glasses of water, such stuff. Now stretch marks, again it's the causes are 4 or 5 important causes I would say. One would definitely be pregnancy in a young woman, and across both weight gain, sudden weight gain, sudden weight loss, this yo-yo kind of diets which cause it, and also exercising. Like when you start to gain muscle mass, your skin stretches and then you will start to have stretch marks. And sometimes if your general condition is not well, you're on tablets like steroids, oral steroids for a long time, you tend to notice stretch marks. All these are generally the causes. Now coming to treatment, it's mainly cosmetic. The main problem about stretch marks is they appear unsightly. They don't look good on the skin. So that's why we get inquiries regarding treatment. Now it's easy to diagnose stretch marks than treat it per se, because treatment is never 100% thing. It's nobody can promise that we'll give you some treatment for stretch marks and it's going to disappear. It's more like reduction of stretch marks, and when I say reduction, it's always better if you start early. Stretch marks typically have I would say 2 grades. The earlier grade where it is reddish in color, it's just the beginning, and when we target it at that point, the results are much better. The older stretch marks, which typically appear as whitish streaks across the skin, now this is very hard and they require multiple sessions. Now regarding the treatment proper of stretch marks, it would be creams. We try retinoid creams, and then there are services like dermabrasion or lasers, which help to an extent, but then it's better when it's done earlier. It's better when it's consistent, like you'll need multiple sessions, not just 1 or 2 sessions. And it's better as a combination treatment when you do services along with creams. I think they give better results. We deal with both dermatology and cosmetology services. Laser hair reduction is one of the premium and I would say most commonly done cosmetic service. We do have premium lasers which we use for laser hair removal, and yes, it can be done both on women and men, though more commonly women avail this service for cosmetic reasons, and men it's becoming more common, especially with beard shaping, because nowadays men they like to have differing shapes of beard, and laser helps to maintain that shape for a very long time. For women, of course it's cosmetic and also aesthetic, because excessive hair growth on women sometimes it could be physiological, we would say. Also sometimes could be pathological because they have some disease and it looks very unsightly, so most of them do come for help, and it gives a tremendous benefit regarding bettering the person's mind. You know, when you look good, you also look, you feel confident. So laser that way helps. And again, when I say laser, I would also like to say that we have trained the staff nurses who do the services, and we recommend around 6 to 8 sessions for optimum results. And it's one of the best selling services I could say in the clinic. Actually done a soft launch of what we call as Amara oxygen therapy service. This is a premium service. It's done with premium range of products, and this is more like the name says, you know, it's more to have your skin refreshed, rejuvenated, kind of relaxed feel. It's an aesthetic enhancement service. It helps to make your skin feel softer, hydrated, and gives you the kind of glow which perhaps an ordinary face therapies or facials would not be able to provide.